Hello YouTubers, Joe Kurza here, March 7th, 2014 at around 1:30 in the afternoon Eastern Time, and it's 49 degrees here and it's sunny and clear and it's just absolutely glorious. It's just absolutely glorious. So it's nice to be able to get out here and well, here, just get out of the house, you know. Yeah, a little bit of paradise down here, guys. Pay no attention to those pink surveying tapes fluttering in the wind. That said, when you hear me sniffing and snorting, that's the maple tree pollen getting a hold on me. You know, the sap's been running for a while. They've been sugaring off up north of us, and I must say our maple trees don't look all that much in bud, but they get, you know, I get snotting around on that when that happens. Whine, whine, whine. Today's been a pretty productive day. I think some of that's due to the fact I actually got a decent night's sleep last night. Thank the good Lord. And another thing that occurred to me too was, you know, I got thinking about why I generally will often have these just sort of generalized internal pain, like I'm being strangled inside, and it occurred to me that's like ischemic pain, you know. I mean, I'm not getting enough blood flow to some stuff, and then it occurred to me, well, I always attributed that to my just long-standing hypertension, you know. But it occurred to me that maybe since I've been losing I've lost 30-some pounds in the last year. I've not been trying to necessarily, but I have managed to. I just don't eat as much anymore. I don't have an appetite anymore. Ever since I got food poisoning in February of 2013, I just don't have an appetite. So I don't eat as much. So I've been losing weight. And it occurred to me that maybe I don't need to take as much medicine as I've been taking. So I'm backing down on the beta blockers a bit, but you have to taper those down very slowly. Otherwise, you can get into trouble. I don't know if that makes a difference or not. You know, maybe tomorrow I'll be griping and pissing and moaning about it. You know, no end. Oh gosh, it's nice. It is nice. I may have to, after I get done with this, come out here on the deck and just sit in the sun for a while. Let me give you another look here. Well, we're back inside now for a while. Not too long, but I do need to talk to you about something else here. Or I want to talk to you about something else. Do you hear that? You hear that? There's no heaters running. I've got everything turned off. It's very nice. Now, along that thing I was telling you about blood pressure treatment and so forth, you know, turns out I was pretty much running out of all my medicines anyway. I typically order drugs every 9 or 10 months, and I'll try to order, well, obviously 9 or 10 months at a time, worth at a time. So I had to do a drug order today from this drug wholesaler that I, get my blood pressure meds from, and so that occupied my time a bit. I got thinking, why don't I just order like 5 years worth and be done with it for a while? And so I did. It was about a $1,600 order. Thank God I can do it, because otherwise, I'll tell you, if I didn't take this stuff, I'd be dead. Well, enough said of that. Now, after that, I was feeling very, very functional and ready to go, and so I thought, well, let's just do my CME here, or get started on my CME, Continuing Medical Education Program. You have to do 50 hours a year of Category 1 in Ohio. And in the states that require it, that's generally the requirement, 50 hours a year of Category 1, although you can do, as many hours of Category 1 as you want, obviously. And then, Category 1 being hours that are accredited by some sort of organization after you do a little bit of a test or do some paperwork, that indicates you've actually covered the material, that sort of thing. So I've gotten in the habit here the last, well, I guess we're going on 12 or 13 years now, of doing the New England Journal of Medicine Continuing Medical Education Program. It is by far, the most bang for your CME buck. I mean, you don't have to go take a trip to high dollar city and stay in a hotel, and that's all fun to do, and I've done that. And but it was getting to the point there, along around 2000 or 2001. 2001 was the last year I did this. I'd go up to Chicago for a week to go to this meeting, and I was dropping $3,000 on that, and I thought, this is ridiculous, and I can do this for about $180. So. It's kind of a no-brainer. And plus, the program I was going to up in Chicago was specifically geared toward anesthesia, and if I ever do anything to a patient again the rest of my life, it ain't going to be going to practice anesthesia. So, this is more geared toward general practice docs and internists. So what you do is, I've already answered some questions, so I won't show you the ones I've answered, because maybe there's an off chance somebody might watch this. Not trying to put out a crib sheet here, but let's see. Come here. It's one of these sort of SAT type answer sheets. I don't know. Maybe it's not now, but it was like the ones we had when, back when I was a boy. In late '60s when I took the SATs. But you've got like, they give you a clinical scenario, and sorry for using the word scenario, by the way. And then, it's choose the best answer. It's not a K-type question where, it's A, B, and C are correct, B and D are correct, A and C are correct, D only is correct, E none of the above, which that question format is that's typical of board examinations, and basically it's a way to ask 300 some questions in 50 questions. I'll tell you though, you got to know the stuff thoroughly to answer those kind of things. But since this is sort of an open book, or in this case, open magazine, self-study thing, that they've gone away from that format. They did that the first 3 years I did this. But I did 9 questions a day. It's 50 questions. Did 9 today. it typically takes me between 6 and 7 days to, I'll do about for an hour and a half, 2 hours, 2.5 hours, you know, in the morning when I do this. So that was, I was feeling very productive today, for what it's worth. And okay, that's it. Nothing else too profound here. Haven't encountered any foolishness I need to remark on, so that's good. All right now. Bye-bye, YouTubers.